Well, hey, good morning, everybody. It's the last 2 weeks, and we're going to go over psychological disorders this week. What's wrong with us in psychology? And the question today in the Google check-in for the 5-5 check-in asks words and phrases that mean crazy. And I think that might be an easy list to make. So make a list of words that you think define as crazy or mean crazy in other ways. We have lots of euphemisms, so to speak, for what crazy is. So first, we're going to take a look at what is a disorder? What makes it a disorder? What makes it an illness, maybe? So we'll talk about the qualities of a disorder. We're going to take a look at some common ones: anxiety disorders, obsessive compulsive disorder, OCD, post-traumatic stress disorder. We're going to take a look at substance use disorders and addiction behaviors. We're going to look at major depressive disorder and bipolar disorder, schizophrenia, and other disorders. There are some really interesting ones, really rare oftentimes, but very interesting disorders that we can take a look at. And does having a disorder mean you're dangerous? And we'll talk about how we treat people with disorders, how we treat people who are ill, and as a society and as individuals, I guess. So first of all, what is a psychological disorder? Well, we're going to take a look at defining it, understanding disorders, okay? Take a look at ADHD, and classifying. How do we label people? Should we label people? Should we label disorders? First of all, we have questions to look at. How do we define what a disorder is? It's a very interesting question exactly, because what is just being eccentric or what is being an actual disorder or illness? When you have something like something psychological, something in your mind, can we decide together that these are disorders in the first place? One of my favorite people in history is Thomas Saz, a cool name. And he suggested in the 60s that there's no such thing as a psychological disorder. That disorder is not illness. That you just have, are eccentric, or you are just different than most in some kind of way, and that there's no such thing as a disorder or illness, and that we use these disorders to control people, essentially, put people in jail, put people in institutions. So it's an interesting take on, what is a psychological disorder? Also, what are the biological factors that contribute? Much of psychology, all of psychology is biological. And even though we can't see oftentimes and measure what's going on biologically, oftentimes on a small scale, cellular scale, we're trying to understand the biological factors involved. We're going to talk about environmental factors as well. Can environmental factors influence illness? And nature and nurture again. How do they interact? We're going to take a look at we're also going to take a look at how to classify these disorders. Are there some disorders that have qualities that are similar? Should we organize them in some kind of way? Also, and the use of labels. Is it important to be labeled as depressed? Okay, or how should I say, anxious, or bipolar? And these labels may have a stigma to them, and they may judge people based upon those. So we've got to be careful with what we call oftentimes these disorders. Well, let's take a look at a definition. First, psychological disorder is a syndrome marked by clinically significant, and these are the three things. These are the three things we're looking for disorder. A disturbance in thought or cognition. Okay. So one of the things that marks a syndrome is that we are, our thoughts are maybe jumbled. Our thoughts are maybe persistent, but something about some kind of disturbance, something that's with our thoughts, with our how we think, okay, essentially. We also take a look at the person's emotional regulation. Are your emotions essentially controllable? At least in the sense of they're not extreme in any kind of way, low or high, or that they're not changing all the time, moving somebody who's moody, so to speak. The moods stay relatively, how should I say, a person who has emotional control, regulates, able to regulate their emotions. Also, we take a look at behavior, what the person does. All right, does stealing compulsively suggest that you have a disorder? And we'll talk about our behavior and how we talk about a disturbance in our behavior. So we take a look at these thoughts, emotions, and behaviors that are maladaptive or dysfunctional. Do they cause you distress? Is the person upset about it? Does it cause behaviors that are don't work in society? Okay. Does it cause you to do things? It makes you dysfunctional. It makes you unable to live life in some kinds of ways. So that's what we're looking for: disruptions in thoughts, emotions, and behaviors. Now, diagnosing disorders varies from culture to culture and over time. In the United States and in much of the Western world, we utilize the DSM-5 to diagnose specific disorders, but it definitely is not universal. So we want to take a look first at what is normal behavior and what is abnormal behavior. Is doing a backflip off a wall normal behavior? Or is it abnormal? And if it's abnormal, does it mean the person who does it is sick or ill? So we take a look at what is normal and abnormal, and these are very difficult terms to assess. A lot of things that don't seem normal, or at least aren't common, don't necessarily mean that somebody is ill. We'll take a look at attention deficit hyperactivity disorder. Okay, the idea that the person is hyperactive and unable to focus. All right, they have extreme inattention or hyperactivity and impulsivity. Okay, oftentimes in childhood. These causes can be genetic. We see it run in families. All right, and it oftentimes coexists with learning disorder or defiant temper-prone behavior. All right, so the kid with ADHD can be difficult, so to speak. And now, how do we treat ADHD? Well, we use stimulant drugs, which is very interesting because um, something that causes an inability to focus, all right, and something that causes hyperactivity, you'd think stimulants would make that worse, aggravate that. But in fact, we find that some stimulants actually can help people with ADHD, kids in particular, focus. So that's one of the treatments. Adderall is one of those drugs that is common with ADHD. And so, that is both a little bit scary and interesting that a stimulant could actually help somebody focus who has hyperactivity. Also therapies. We're looking at therapies to help somebody. So for example, behavioral therapy. So what do you do when you are feeling lost? So we take a look at different types of therapies, cognitive therapies. How do we address your thoughts in these situations? So some look at normal and abnormal behavior. First, um, skeptics of ADHD suggest that this is just an energetic child, that we diagnose ADHD too much. And the kid is just energetic and the classroom is boring, and that's why we label them with ADHD. At least that's what some skeptics suggest. Um, Skeptics are concerned about stimulant prescriptions, that those are being used. And in fact, there is somewhat of an underground market for Adderall and other stimulant drugs that can be abused. Also, we're not quite sure about the long-term effects. Treatment for ADHD is relatively modern, and we don't know how that's going to affect kids later on. And we're not quite sure. We're seeing more and more ADHD, and it could be that it's increasing, that more people have ADHD, or it also could be that we are diagnosing it more. which means people are labeling it more when they go into for treatment, or as skeptics suggest, maybe over-diagnosing. We are diagnosing kids who are just energetic and problems in the classroom. Supporters of ADHD suggest that um, that we have more diagnoses because we're just aware of it more. It's something more modern, label, classification, and we're just aware of it more. And it's real. It's neurobiological, and we can see it in the brain of somebody with ADHD. And we also see abnormal brain patterns with somebody with ADHD. So both kind of skeptics and supporters of the idea of diagnosing ADHD. Take a look at some therapies throughout history. All right. And historically, we treat people with mental illness brutally. And in this case, we see a skull with holes bore into the skull, a prehistoric skull, Stone Age skull, at least. And the idea is that we believe that this is possibly an attempt to relieve spirits from somebody who was maybe schizophrenic or somebody who was ill, an attempt to give therapy to somebody who was ill. Today, we try to look at it medically, all right? That disorders have physical causes, and they need to be diagnosed, treated, and possibly cured, although cure is a difficult one to talk about when we talk about therapies for psychology. We diagnose it based upon symptoms, what we see, symptoms and behaviors, and other symptoms that we mentioned earlier. And it's cured through therapy, and this could be treatment in a psychiatric hospital. This could be outpatient treatment. This could be counseling. So when we take a look at the biopsychosocial approach, all right, that disorders are this interaction between our body, once again, our genetics, our body, our brain, what's going on in our mind, the psychological part, and the sociocultural part, what's going on in our lives, what environments we're living, and how all three of those together form these behaviors, thoughts, and feelings. That's the biopsychosocial approach. And epigenetics, once again, is the study of our influences, how the environment influences our DNA, meaning, as we're growing up, how does the environment we grow up in, whether it's an abusive environment, whether it's a toxic, like literally toxic environment, like smog or pollution, how does the environment affect our gene expression, the potential that is locked within our genes? Because in one environment, this gene may lie dormant. It may not engage, so to speak, or show itself. All right. And then in another environment, it'll be expressed. And so we take a look at epigenetics, how our environment affects our genetic predisposition. In psychology, we try to classify disorders. All right. And we try to do so we can predict the future course. Where is this headed? All right. If you are labeled depressed or having depression, what can we, where is this going to go? What's going to happen to you because of this? It suggests treatment. How do we ease the disorder? Right? It helps us research it. Right? And we use what is called the DSM-5. The 5 came out in 2013, and essentially it's a big old long manual of thousands of disorders. And we use it to help diagnose. Psychiatrists and psychologists use it to help diagnose how often these disorders happen. So we take a look at the characteristics of the disorder, the classification, and we see if those apply to a patient. And the DSM-5 reflects changes. This changes with every new edition. It is debated what should go in the DSM-5, what should be disorder and what should not. Right. Recently, we have changed, or at least in 2013, we changed autism and Asperger's syndrome. They are combined. We combine those into what we call autism spectrum disorder. All right. We changed mental retardation. We changed that label to intellectually disability. All right. And we added categories. Hoarding disorder, you ever see hoard, binge eating disorder, and others. There's criticism of the DSM-5 that diagnosis is not similar throughout. Like one psychologist may not diagnose the same thing as other psychologists, and so there's variability um, uh, that it's difficult to apply sometimes. It's not as objective as we hope it could be. And so a few of those in particular: antisocial personality disorder, generalized anxiety disorder. A lot of these had clinicians had a hard time agreeing on what these were, what characteristics were needed to be antisocial, have antisocial personality disorder, those kinds of things. Also, there's criticism that the DSM-5 casts too wide of a net, that it's too much. There shouldn't be thousands of disorders. Um, uh, and at the moment, it seems to include any kind of behavior within psychiatry, and that's quite large. And it may help us actually, oddly, find more illness. The idea is pathologizing everyday life. Essentially, it's saying, hey, these behaviors are relatively normal. These behaviors are reasonable, and that not everything is an illness. Okay, not everything we do is sick, and that there can be bias in labels. That labeling somebody creates this bias, and even the process of labeling somebody is filled with bias. We're seeing more actually in our world. We're seeing more realistic portrayals of illness. In this more optimistic depictions, rather than people are just crazy or loony or out there. That there is real research, and that beyond just the stereotype of being ill or sick, that we can see these disorders portrayed more realistically. You see this image here is of John Stark in Iron Man 3. John Stark? Yeah, I think so. Iron Man 3, and he has post-traumatic stress disorder. What are the risks of labels? Well, first, self-fulfilling. If you're labeled depressed, then you may actually believe and become depressed. All right? And also, we see mentally ill people as dangerous, and that may not actually be the case. Any more dangerous than people without mental illness. Okay. The benefits, well, it helps guide diagnosis and treatment. All right, and they help professionals communicate about causes and the cases that they see. So it helps research and communication and treatment and those kind of things by labeling people. Hey, that's all I have for today, guys. I'll connect with you this week with another one later. Check in on Thursday. Check in on Friday. I'll have another PowerPoint for you this week to talk about psychological disorders. Thanks, guys.